Hello, my name is Cristina Ionuțiu Luciana. My ID number is N30349422. And now today I will present my core personal, professional and employability skills as a mental health dementia practitioner, as a critical self-reflection. Through my journey as a mental health dementia practitioner, I have dedicated myself to honing essential personal, professional, and employability skills. In this presentation, we'll assess my growth in this area, specifically focusing on compassion, values, and behaviors. By engaging in self-reflection, I aim to understand how these abilities have influenced my practice and identify areas for future improvement. This evaluation will serve as a valuable tool for future development and engagement, enabling me to provide even better care and support to my individuals with dementia and their families. As a mental health dementia practitioner, my work is rooted in empathy. I have dedicated significant effort to gaining a deeper understanding of the emotional challenges faced by individuals with dementia. By actively listening and empathizing, I have successfully. Nevertheless, maintaining compassion in emotional charged situations can be challenging. To prevent burnout and sustain my compassionate attitude, I am committed to exploring various strategies, including self-care practice and seeking support for my colleagues. My interaction with individuals with dementia and their families are guided by fundamental values such as respect, dignity, and autonomy. I have worked diligently to develop a person-centered approach that ensures care plans are tailored to their needs and preferences. However, the realities of healthcare settings often present challenges in upholding these values. Striking a balance between person-centered care and organizational recruitment is an ongoing endeavor that necessitates adaptability and effective communication. I have made it my mission to constantly broaden my knowledge and understanding of dementia. By staying updated on current research advancement and evidence-based practice, I am able to provide informed and adequate treatment to my patients. However, I acknowledge the importance of continuing my professional development to ensure that I'm using the most up-to-date information and practice in my practices. This entails attending conferences, participating in relevant training programs, and engaging in critical exchange with my peers. These activities help me stay current and enhance my skills as a practitioner, ultimately benefiting the individuals I serve. In mental health dementia care, effective and productive communications is vital. I have invested significant effort into enhancing my communication skills, mainly when it involves conveying challenging information to patients, families, and colleagues in a sensitive and accessible manner. However, I understand that there is always room for growth. To further improve my abilities, I can focus on honing my active listening skills, paying attention to nonverbal cues, and adapting my communication style to meet the unique needs of different individuals. By continuously working on this aspect, I can ensure that my communication is empathic, transparent, and tailored to facilitate understanding and connection in mental health dementia. Teamwork and collaboration are integral aspects of my job, and I recognize the significance of working effectively in cross-disciplinary teams. I understand the importance of, however, I have encountered challenges is resolving conflicts and maintaining harmonious relationship within the team. Moving forward, I am committed to developing strategy for constructive conflict resolution and fostering a healthy team dynamic. To address these challenges, I will prioritize the following approach: open and honest communication, encouraging open dialogue among team members where everyone feels comfortable expressing their thought and concern can help prevent misunderstanding and promote effective problem solving. Active listening and empathy. Active listening to my team's viewpoints and showing compassion toward their perspective can create an atmosphere of understanding and mutual respect. Establishing shared goals and expectation. Defining shared goals and expectation can align the team's effort and fosters a sense of unity. I can be achieved through regular team meetings where objectives are clarified and roles and responsibilities are discussed. Constructive conflict resolutions. Developing strategies for addressing conflicts is crucial. It may involve creating a safe space for open discussion, seeking mediation or facilitation, and encouraging compromise and collaboration to find mutually beneficial solution. Building trust and fostering a positive team culture. Cultivating trust among team members through transparency, reliability, and accountability is essential. Additionally, promoting a positive team culture that celebrates achievement, encouragement, professional growth, and appreciate individuals' contribution can strengthen the team bond. Regular team reflection and evaluation. Conducting periodic team reflection and assessment can help identify areas for improvement and address any emerging issues proactively. It may involve soliciting feedback for team members, discussing success and challenges, and implementing necessary adjustment. By implementing these strategies, I aim to improve them dynamics, resolve issues constructively, and create supportive and collaborative environment. Ultimately, this effort will enhance our collective ability to provide the best possible care to our patients. Reflective practice and continuous learning are vital to my professional development as a mental health dementia practitioner. Regular self-reflection has proven to be highly beneficial as it enabled me to identify areas for improvement and learn from past experience. I actively seek opportunities for ongoing learning, such as attending workshops, seeing feedback from supervisors and peers, and staying abreast of a new research and practice in the field. To further enhance my abilities, I recognize the importance of adopting a growth mindset and being open to constructive feedback. Embracing a continuous growth and improvement philosophy will allow me to expand my knowledge and skills, ultimately benefiting the individuals with dementia and the families I serve. Personal development is crucial for building essential employability skills, including compassion, beliefs, and behaviors. Evaluating these skills is necessary to identify areas of strength and areas that require improvement, and improvement by examining my professional growth and understanding how the abilities impact patients' outcomes, work, happiness, and professional progress. I can chart a path for development. Here are some steps I can take as a dementia practitioner. Self-assessment. Reflect on your skills, beliefs, and behaviors related compassion and patient care. Consider your strengths and areas where you feel there is room for improvement. Be honest and open to self-reflection. Seek feedback. Request feedback from colleagues, supervisors, and patients or their families. Their perspective can provide valuable insight into my strengths and areas needing further development. Set goals. Based on my self-assessment and feedback, establish specific goals for improvement. These goals should be measurable, attainable, relevant, and time-bound. For example, I may aim to engage active listening skills or practice empathy in challenging situations. Professional development opportunities. Look for professional development opportunities that align with my identified areas for improvement. Attend workshops, seminars, or training programs that enhance compassion and patient-centered care. Engage in activities that foster personal growth, such as reading relevant literature or participating in online course. Practice and apply. Apply what I learn from professional development opportunities in my daily work. Practice compassion and patient-centered care consistently, incorporating new skills and approach. Reflect on your experience and adjust my strategy as a need. Evaluate outcomes. Regularly assess the impact of my personal development efforts on patient outcomes. Work happiness and professional progress. Consider gathering patient feedback, measuring satisfaction level, and tracking my personal growth and fulfillment in my role. Continuous learning and adaptation. Personal development is an ongoing process. Stay updated with the latest research trends and best practices in mental health dementia care. Be open to adapting my benefits and behavior based on new information and involving patient needs. Be constantly evaluating and improving the skills professional can positively impact patient outcomes, find greater satisfaction in their work, and advance professionally in mental health dementia care. As a mental health dementia practitioner, establishing and maintaining personal, professional, and employability skills is an ongoing lifelong journey. Evaluating this progress in acquiring these skills through critical analysis and reflection can help increase understanding. By prioritizing compassion, values, and behaviors, I can continually strive for improvement, enhancing the quality of care provided to individuals with dementia and positively impacting their lives. Through critical analysis, I have identified areas of strength and areas to require further growth in establishing essential employability skills as a mental health dementia practitioner. By self-reflection and committing to continuous improvement, I aim to cultivate and strength by compassionate attitude uphold my core principles and enhance my professional abilities. By doing so, I can consistently provide high quality care to individuals with dementia and contribute to their overall well-being. Recognize that personal and professional growth is reflection, learning, opportunities, and committed to improvement. I will strive to provide the best possible care and positively impact the lives of individuals with dementia. Thank you very much.